Hello, everyone. Welcome to VMC Medical Coding. My name is Eli Rada. I am a certified trainer for medical coding and also for clinical documentation improvement. If you guys are new to this channel, please don't forget to subscribe, like, and share, and also turn on that notification so I can alert you for future videos. And if you have questions or comments, please feel free to leave me a message at the comment box and I will respond to your question as soon as I can. Here is the presentation for today. All right, now let's go back here. What about the I-50? What about the I-50? I-50 is a code for heart failure. You see these guys? Heart failure. So what are those heart failures that we are familiar with, or common heart failures that you would most likely see in the patient's chart? When you talk about heart failure, guys, there are a few types of heart failures that you would most likely encounter when you are when you start doing your job as coders. So the unspecified heart failure is the abbreviation is CHF, or which is known as congestive heart failure. This is a very common abbreviation, very common heart failure description that any provider, any doctor would document. CHF. That means to say that patient's, patient's heart is not functioning as it should function in the best capacity. So what I mean by that is congestive heart failure, guys, from how I understand it, this is a heart condition that that patient is diagnosed with when the heart fails to eject the required blood from the chamber where it's coming from and distribute this blood, the oxygenated blood, to the system. So there are times when the heart is so stiff, we call it hypertrophic type of heart muscle, and when it's so stiff, it's having a hard time pumping blood out to the system. So those are one of those factors or reasons why a heart would fail in doing its function. And what happens if the blood that retains in the in the chamber where it's coming from before it gets pumped out to the system continues to to remain in that chamber? What happens now? Patient starts to develop what we call fluid overload. Fluid overload, which will turn into what is called pleural effusion, because that fluid will eventually end up deposited into the pleural cavity, which is in the lung. So when that happens, the lung is having a hard time getting oxygen from the outside because of the massive fluid that is enveloping the lung, and it's not able to expand it is in its maximum capacity. So that's what happens, and when that disease process takes place, what's going on now is that a patient starts having a shortness of breath. It's like gasping for air, something like that, unless that fluid that is stuck in the pleural cavity is removed. So that's what heart failure, from my simple understanding. Now that I have explained to you what heart failure is, there are a few types of heart failure, guys. Okay, so CHF, there is what we call diastolic. Okay, heart failure, diastolic CHF, and the other one is systolic CHF. And this one has something to do with how the heart contracts and also relaxes. That's what it means, right? So There are also different types of severity of, or acuity of this heart failure. Sometimes doctor would document acute heart failure or chronic heart failure, or sometimes acute and chronic heart failure. So there are different types of heart failure, and there are specific codes for those each type. So you got to remember that, guys. Nowadays, doctors use a more specific description of a heart failure based on the heart's capacity to inject, the blood, the oxygenated blood from the left ventricle. But in that, by that measure of ejection fraction, we call it ejection fraction. Let me write it down, guys. Ejection fraction can be seen from a what we call the echo test, ECHO test. So this is an imaging that can capture the the ability of the heart muscle to to contract and relax. Okay, this is the echo right here. Okay, now they based the type of heart failure based on the percentage of the ejection fraction of the left ventricle. If it's too low, okay, if it's too low, like below, I think below 45%, they call it systolic. If it's above 45%, they call it diastolic. And nowadays they use a different abbreviation. The diastolic heart failure is documented for the most part as, let me write it down here, heart failure with preserved ejection fraction. The systolic heart CHF is documented, let's see here, heart failure with reduced ejection fraction. That is how these days doctors document what type of heart failure the patient has. Now, what is the significance of what I'm showing you here, guys? If a patient has hypertension and has these types of heart disease, this heart failure, how are you guys going to code hypertension? What do you think? What is the hypertension code that you guys are going to apply then? Now you can go back to the book. Let's see here, okay? It says here, what the guidelines are saying, a hypertensive heart disease usage from category I-50 heart failure to identify a heart failure in those patients with heart failure. Okay. This one right here, it says, use or assign a code from category I-11 hypertensive heart disease and use additional codes from category I-50 heart failure to identify the type of heart failure. There you go. Now, what I just read makes sense. What I'm saying here, guys, is that we already know if it's not heart failure, we assign I-11.9, right? For hypertension, with other heart conditions, it start with I-51, right? Now, if the patient has heart failure and the code obviously starts with I-50, this guy's here, your category code starts with I-50. Okay? This guy's here. So what hypertension code, guys, do you now apply if the heart condition, which is heart failure here, start with I-50? Go back to the book and tell me what hypertension code do you apply. Go back to your I-11 in the tabular. Christine says it's I-10, and Karen also agrees to that. okay, confers with that. So yes, I agree that now your hypertension code, let's say for example, patient has CHF and also hypertension, right? Now your hypertension code now will have to have this I11 I11.0 code. Okay, let me make that clear. Is that clear, guys? It's not I10, it's not I11.9, it is I11.0.